Good afternoon. My lecture today is about periodontal emotional stress syndrome. This lecture is presented by Harim Jafar Hamar Rashid, lecturer at School of Dentistry, Periodontic Department. Let's take a review on stress. Actually, stress is an unavoidable consequence of life. It's described as adverse emotion or reaction to an unpleasant experience. Thus, stress can be viewed as a process with both physiological and psychological component. The possible mechanisms by which psychosocial factors act on periodontal tissue are oral hygiene negligence, change in dietary intake, smoking, bruxism, gingival circulation, alteration in salivary component and flow, hormonal change, and lowered host resistance. During stress, hypothalamic pituitary adrenal HPA and the sympathetic nervous system interact and release glucocorticoid, which has immediate effects that disrupt the homeostasis and lead to increased susceptibility to periodontal disease. The dental practitioner thus may always decide to refer patient to appropriate professional for assistance and counseling. Therefore, reducing stress and improving coping strategies may improve the periodontal prognosis and treatment outcomes. The aim of this lecture is to provide an insight into the relationship between psychological stress and periodontal disease. A scientist, Seyle, in 1976, he was basically responsible for defining stress as the response state of an organism to physical and mental forces beyond the adaptive capacity that leads to disease of adaptation and eventually to exhaustion and death. Seyle recognized stressors which act to produce positive change in the body, leading to a response state which is defined as eustress. So the positive stress is named eustress, or stressors could be negative that induce threatening homeostasis with pain, discomfort, physical pathology. He defined the negative response state as distress. Regarding the pathophysiology of stress response, psychosocial stress can affect the periodontal tissue directly through the biological mechanism and indirectly through the change in lifestyle, such as ignoring oral hygiene measures, smoking more heavily, and consuming more fat and sugar in diets. Hence, there are two proposed mechanistic links, one biological and the other behavioral. The biological mechanism emphasizes how stress and depression can reduce immune system function and facilitate chronic inflammation. Whereas in physiological response to stress, the hypothalamus pituitary adrenal cortex is stimulated that lead to the secretion of corticotrophin releasing factors and vasopressin from an anterior hypothalamus, and the pituitary gland in turn release adrenocorticotropic hormone, which act on the adrenal cortex and increase the production and release of cortisol and glucocorticoids hormone. The glucocorticoids then reduces the immunocompetence through myriad of effects, including suppression of the inflammatory response, inhibiting immunoglobulin IgA and IgG, and neutrophil function, which lead to increased biofilm colonization and reduce the ability to prevent connective tissue invasion, and to also modify the cytokine profile, primary interleukin, and tumor necrosis factors, and it will lead to elevation of blood glucose level and altering the levels of certain growth factors. Additionally, after periods of chronic elevation of cortisol loses its ability to inhibit inflammatory response initiated by immune reaction, which leads to chronic inflammatory destruction within the periodontium. The autonomic nervous system also gets activated to induce the autoimmune system also gets activated to induce the release of adrenaline, as you see here. Adrenaline, epinephrine, and norepinephrine from the adrenal medulla, while various neuropeptides such as substance P are released from the sensory nerve fibers. Under ideal circumstances, these factors function are to harmonize to enable the organism to ward off the stressful event and maintain homeostasis. So as you see in this diagram, there's here major life events. You see environmental influences, psychological factors, systemic illnesses, and daily hassles, or are caused by stress, or these environmental influences and major life events will create stresses. And stress by itself, it will enhance the hypothalamus and the anterior pituitary, which will enhance the adrenal medulla to increase the cortisol secretion, and the cortisol secretion by in turn it will suppress the inflammatory response and increase the blood glucose, also alters the growth factor levels and cytokine levels. In another direct way, it will affect the autonomic nervous system, which by turn also cause the adrenal medulla to increase the secretion of epinephrine and norepinephrine, and in turn it will lead to increased glucose blood level and alter immune response. And both of these two mechanisms will lead to increased susceptibility to periodontal disease. So, and there's an indirect mechanism by which poor coping strategies, poor adaptability to stress will lead to health impairing behavior like poor oral hygiene or negligence, and cigarette and alcohol consumption, forgetfulness and disrupted sleeping pattern, and poor nutritional intake. The stress effect on the periodontium. First of all, we must know that stress is regarded as a cognitive perception of uncontrollability or unpredictability that's expressed in physiological and behavioral response. Stress is often classified as an acute and a chronic type. Acute stress lasts for a period of minutes to hours, whereas chronic stress persists for several hours, a day, weeks, or even months. In case of acute stress response may prepare the immune system for challenges such as infection that may be imposed by the stressor. When stress becomes chronic, it may influence the inflammatory process, leading to development of systemic or local disease such as rheumatoid arthritis, diabetes, cardiovascular diseases, or periodontal diseases. The stress effect on the periodontium, the possible mechanism by which psychosocial factors act on periodontal tissue are oral hygiene negligence, change in dietary intake, smoking, bruxism, change in gingival circulation, and alteration in the salivary flow and components, both the flow and components of the saliva are affected, endocrine hormonal change, and lower host resistance. Harmful effects that result from psychic influences on the organic control of tissue are known as psychosomatic disorders. There are two ways in which psychosomatic disorder may be induced in the oral cavity. One, through the development of habits that are injurious to the periodontium, and by the direct effect of the autonomic nervous system on the physiologic tissue balance. So, through the development of habits that are injurious to the periodontium and by the direct effect of autonomic nervous system on the physiologic tissue. Stress and physiological changes. There is alteration in salivary flow and components. Psychosocial stress or emotional disturbances produce a transient reduction in the salivary flow and change in the salivary components. Saliva in turn relates to plaque formation. As we know, saliva relates to plaque formation, calculus deposition, and antibacterial and proteolytic activities, all of which may have a bearing on periodontal diseases. Blood and saliva can be used to monitor the systemic as well as the oral health status. Furthermore, stress is also a factor that can be followed by analysis of saliva, especially by determining the levels of stress-related markers. These markers have biological properties that influence genesis and development of periodontal disease. There are numerous stress-related molecules involved in different aspects of stress response. One of them is cortisol. Cortisol is a well-known stress-related hormone that can be detected in blood, saliva, and gingival crevicular fluid. Salivary level of cortisol reliably reflects hypothalamus pituitary adrenocorticoid activity and is used in human psychological studies as a biological marker of stress. Cortisol acts as an anti-inflammatory and immunosuppressive hormone by inhibiting the formation of T lymphocyte and suppressing the function of natural killer or macrophage, thus affecting the host immune response of the periodontium. The cortisol it affects the blood glucose level, and it will increase the blood sugar concentration and influence the metabolism, as well as second, the catecholamines. Catecholamines relay information from the CNS to the immune system. Catecholamines modulate a wide range of immune functions, including cell proliferation, inhibition of pro-inflammatory cytokines such as interferon gamma, interleukins, and so on. Salivary catecholamines are elevated by psychological stress factors and serve as a useful index of sympathetic adrenomedullary system activity. Another one is neuropeptides. Neuropeptides such as substance P is important in initiating and sustaining inflammation, increasing pro-inflammatory cytokine production, and by limiting the production of transforming growth factor B. These markers generally act as hormonal mediators and play a role in the ability of stress to promote disease by influencing the host response. Stress, another topic is stress and behavioral change. Stress will affect the oral hygiene negligence. It's obvious that a proper oral hygiene is partially dependent on the mental health status of the patient, and some patients may be disturbed or distracted psychologically so that personal hygiene is neglected, and other patients may intentionally ignore oral hygiene to fulfill deep neurotic needs. The second one is changing in dietary intake. Emotional conditions are thought to modify dietary intakes, thus indirectly affecting periodontal status. This can involve, for instance, the consumption of the excessive quantities of refined carbohydrates, and soft diets required less vigorous mastication and therefore predisposing to plaque accumulation at the proximal risk sites. The third one is parafunctional habits. One classical hypothesis for the role of stress in periodontal disease was directly caused by bruxism and clenching that directly lead to loss of periodontal attachment apparatus in the absence of the other factors. So the parafunctional habits also include in the behavioral change that's caused by the stress. The fourth one is use of tobacco and its products. Understanding the cytotoxic effects of tobacco use and nicotine dependence is essential for adequate patient management. Nicotine is highly psychoactive tertiary amine. Chronic exposure to nicotine stimulates release of dopamine into the CNS and to the neural clefts and other sites, and proliferation of nicotine acetylcholine receptors on the postsynaptic neurons. Brain metabolism initially increase and then stabilize in the presence of nicotine. With repeated exposure, CNS stimulation by nicotine gradually wanes and the presence of nicotine became necessary to ward off the withdrawal symptoms. Nicotine dependence is not only a risk factor for the periodontal disease, but it's a disease requiring treatment in its own right. Psychosocial stress and periodontal disease. First of all, gingivitis. Gingivitis is the organism's response to persistent microbial plaque and is characterized by a well-established inflammation affecting the superficial gingival connective tissue. Stress, according to the thesis, stress will diminish the salivary flow and increase the dental plaque formation, which lead to gingival inflammation. So stress affects on the formation of and accumulation of plaques, and by this way it will increase the inflammatory response, acute inflammatory response, and it will aggravate the disease. Second, stress and periodontal. According to Corgin et al., found acute necrotizing ulcerative gingivitis. In comparing to control, he found that there is, in acute necrotizing ulcerative gingivitis, there's a depressed polymorphonucleus chemotaxis and phagocytosis. And there is reduced proliferation of lymphocyte upon stimulation by a non-specific mitogen. They also suggested that depression of some host defense mechanism under stress condition may be important in the pathogenesis of acute necrotizing ulcerative gingivitis. Second, periodontitis. Acute Psychological stress induces local release of interleukins, especially interleukin 8. And according to the Paggi et al., he described aggressive periodontitis as a particular disease and established the link existing between aggressive periodontitis and psychosocial factors and loss of appetite. In case control study, in 1996, Monteira da Silva showed that people with aggressive periodontitis were more depressed and more socially isolated than people with chronic periodontitis or control group. Also, we must talk about the response of stressful patient to periodontal treatment. Kama and Bernie in 2003 conducted a study to evaluate the clinical and microbiological status of patients with aggressive periodontitis who had received supportive periodontal care every 3 to 6 months for a period of 5 years following active periodontal treatment. The results showed that supportive periodontal care was effective, but some sites in some patients were still progressive. And this can be explained by the presence of variable bacteria such as P. gingivalis, Treponema denticola, and the number of acute episodes, smoking, and also they found that the stress are responsible for progression of the disease. So we are going to the stress reduction protocol in dental office. They advise that recognition of medical risks and anxieties is essential. Medical consultation, pre-medications like an anxiety or sedative or hypnotic drugs an hour before an appointment should be taken. Fourthly, appointment scheduling. Fifth, minimizing waiting time to reduce anxiety. Sixth, vital sign monitoring. And seven is sedation. While something should be the patient should take in consideration for reducing the stress in home, for example. First of all, management of patient by himself. First of all is regular exercise to help to burn off and use up the stress hormones and neurochemicals. Second, the benefits of mediation and other relaxation technique for 20 to 30 minutes session. Thirdly, elimination of drug use. Some of the drugs that causing stress and depressions. Strengthen your relationship by building a strong support network with the others. And the fifth, learn better ways to manage time. Think about which things are most important and do those first. Six, find better way to cope. Look at how you have been dealing with stress. Be honest about what works and what doesn't work. Think about other things that may work better. 7, take a good care of yourself. Get plenty of rest, eat well, don't smoke. Try out new ways of thinking and learn to say no. Speak up. Not being able to talk about your needs and concerns creates stress and can make negative feelings. And ask for help. People who have a strong network of family and friends manage stress better. So in conclusion, there is no doubt that stress has important clinical implications in periodontal disease development and also influence treatment outcome. Identifying reliable stress-related biomarkers in saliva may eventually end up in development of chairside tests with potentially multidisciplinary application. The dental practitioner may always decide to refer patient to appropriate professional for assistance and counseling. Therefore, determining patients under chronic stress could develop specific multidisciplinary treatment strategies for ultimate effect of coping with the stress factors and improvement of prognosis and outcomes of periodontal treatment. Thanks for your listening. This is the end of my lecture.